Guys, welcome back to our channel Dr. Stethoscope. Today I am going to teach you cerebrospinal fluid. So from the name itself, you can see here cerebro and spinal. Cerebro means brain and spinal means spine. So from the name itself, you can understand that what does this mean. Cerebrospinal fluid is something related to the brain and the spine. So with this concept, we can go to the chapter. CSF or cerebrospinal fluid are clear, colorless, odorless fluid. It doesn't have any kind of color, and it don't have any kind of smell. And found in the ventricle of the brain, central canal of spinal cord. It's very important point, in the brain and the spine, CSF is in the ventricle of the brain and the central canal of the spinal cord. Then subarachnoid space, subarachnoid space. It is a modified tissue fluid and replaces lymph in CNS. So lymph is equal to CSF in CNS. So it is considered to be as a lymph in CNS. I hope you have understand the introduction part. So let's go to and I have an image for you to show. This portion, you can see here that the green, my pink line is going, the light blue shade is subarachnoid space, and you can see where the cerebrospinal fluids are there. The blue color all are cerebrospinal fluids, and it is on the ventricles of the brain. Then the central canal, you can see here that these two lines, central canal of the spinal cord. So let's go to the formation. Next topic, formation of CSF. So CSF formed by choroid plexus of lateral ventricles and lesser amount by choroid plexus of third and fourth ventricle. So there are three types of formations. For one, choroid plexus of lateral ventricle, choroid plexus of third and fourth ventricle, then also formed by capillaries on surface of brain and also by capillary. So these three are the formation. Bulk of CSF are formed from choroid plexus of lateral ventricles, lesser amount by choroid plexus of third ventricle. So the choroid plexus are high and the third and fourth ventricle produce a less only. So here you can see the cerebrospinal fluid again. I have shown you more and more images for your easy understanding, and this blue color shows the cerebrospinal fluid. You can see the central canal and all, and the part where which cerebrospinal fluid are situated. I hope you understand. So let's go to the next part, circulation. Circulation we can study after some time, because circulation is a long process to study. So I will teach you afterwards. Let's go to the next part, absorption. Absorption through arachnoid villi and granulations drained to cranial venous sinuses. So then partially absorbed by perineural lymphatics around first, second and third cranial nerve. Also CSF are absorbed by veins related to the spinal nerves. Okay, then we are going for the composition. Composition means that what all things are the composite to form CSF. We can see here that it is a total count, and these three informations are I got from BD Chaurasia. Okay, these three are from BDC. Okay. Then it is about total quantity is about 150 ml formed at a rate of 200 ml per hour or 5000 ml per day. Then it's a normal pressure, and normal pressure is about 6200 mm H2O. I mean here it is H2O. So protein, and the protein is about 15 to 14 ml per dl. Then deciliter. then glucose, chloride, cells, specific gravity, pH. These everything I get from Wikipedia. So glucose are about 40 to 60 and chloride is to 120 to 180, and this is 1 centimilliliter. C.ml means that centimilliliter. Centimilliliter. So specific gravity is about 1.003 to 1.008. Then pH is about 7.35. So next we have to learn the functions of the cerebrospinal fluid. Before going to the functions, we can just go through the circulation now. Circulation is a vast topic, not vast, but just you have to be with your full mind to learn the circulation part. So CSF passes from lateral ventricle to the third ventricle, lateral ventricle to third ventricle, lateral ventricle to third ventricle through, and this passes through interventricular foramen of Monroe. Okay, then from the third ventricle it passes to the fourth ventricle. From the third ventricle it passes through the fourth ventricle to the fourth ventricle through cerebral aqueduct. Okay, then next is from the fourth ventricle CSF passes through the subarachnoid spaces. Subarachnoid spaces, and this happens through from fourth ventricle to the subarachnoid spaces. It passes from from fourth ventricle to the subarachnoid spaces, and then it is moving to the vertebral canal through the median and lateral apertures of fourth ventricle. Okay, which means that it passes through central canal. From subarachnoid space passes to subarachnoid spaces of cerebrum and also vertebral canal through median and lateral apertures of fourth ventricle. Then somehow it moves through the central canal. And this is the circulation. Look, from lateral ventricle, then moves to the third ventricle, then fourth ventricle, then the fourth ventricle, subarachnoid spaces and vertebral canal through median and lateral apertures of fourth ventricle. Then finally it ends to the central canal. And where does this central canal situated? Central canal of spinal cord. Don't forget that. Central canal is a part of spinal cord. Okay, then let's go to the next topic. Functions. What are the functions of cerebrospinal fluid? Then cerebrospinal fluid decreases a sudden pressure or forces. And what does this sudden pressure or forces means, that I will explain you now. You can see here that when we hit our head at any surfaces, our brain is just a hollow organ. The organ is just supported by a hollow thick bone called skull, isn't it? So when something shakes happens, then our brain will automatically moves very vigorously. To avoid this, this cerebrospinal fluid floats with the brain, in which brain is like this, and the cerebrospinal fluid support this brain wholly. You know that. Then this force will decreases a lot. So, and brain will not feel any kind of suffocation while we are hitting hitting like a small hitting. I mean that not very harsh hitting, a small hitting. Okay, small hitted. Then nourishes nervous tissue. Then glucose and oxygen supply provided by CSF of neurons. You know that our CNS cannot stand more than 3 to 2 minutes without oxygen and glucose. So these stabilizes. I mean neurons can stabilize more than 2 to 3 minutes without oxygen and glucose. So cerebrospinal fluid supports them by providing adequate amount of glucose and oxygen. Then pineal gland secretion reach pituitary gland via CSF. You know that pituitary gland via CSF means cerebrospinal fluid. Act as fluid cushion. I have already explained why it is called as fluid cushion. So next we are going to learn only two clinical anatomy for your, just for the knowledge. It's not as important. We will learn more about in coming years of education. So lumbar puncture. I have already explained that the lumbar, when I teach you the lumbar area, the lumbar L3, L4 are the most very important area to take cerebrospinal fluid. You can see here that the spinal fluid is inserted on the L3 and L4, between L3 and L4, and the doctor will take the cerebrospinal fluid for further testings and all. Okay, drainage of CSF at regular intervals for checking the meningitis and all. Okay. Then here is the side hydrocephalus. We have already seen that hydrocephalus children's and all. Endosulfan is also causing hydrocephalus like substances and that kind of issues and all. Hydrocephalus is a dilation of ventricular system and occurs due to the obstruction of CSF circulation. You can see here that it's a normal ventricle and the enlarged ventricle. This is due to the CSF abnormality, which gives more pressure to the sides walls of the skull, and it causes very serious issues and to the child. So these are CSF, cerebrospinal fluid. I hope you have understand the chapter. This is a part of neuroanatomy. Not forget, this is a part of neuroanatomy. Next class we will learn about more about next topics. I hope you have enjoyed the class. So stay tuned for the next classes. I will upload the classes as when I am free. I will upload new videos. Support my channel. Thank you.